All too often we see women starting to give up, things they do. They quit going to the gym. They get out of shape because they're embarrassed. They have to just learn that they're going to have to wear a pad the rest of their life. There are many devices that have been brought to women's health care in regards to treating them with vaginal issues, patients who complain of incontinence or the like. ThermiVa, very pronounced in the world today. It's been around for a long time, but I would see initial results, and basically it was from the edema, the swelling effect from the heat. The heat is not even to the point to get to the whole topic of bringing collagen back. Over the 3, 4, 5, 6 months, patients would return and they would say, you know what, I initially saw some relief, but it's been 4 months and I'm back where I was started from. And it's really disappointing. So I looked more and more and found Geneveve. And I'm actually having to retreat my ThermiVa patients with Geneveve to get that success that I initially looked for when I purchased my first device. The technique we use with ThermiVa is a constant in and out motion with a wand. And for the patient, it might be more embarrassing. We cannot get reproduced results from patient to patient. It's more operator dependent. With Geneveve, it's technique and it's machine dependent because we're not doing that in and out stroking with a wand. We actually place the device at a certain area. We cryogen cool the superficial tissue, deliver the heat, and then we move the wand to the next spot. With a ThermiVa device, we're treating a patient every 4 weeks for 3 visits. So we're talking 3 months of a patient having to come back and forth. With Geneveve, it's a single session, it's 30 minutes, and they're out with simply no downtime, no pain, and with much, much superior results. Geneveve is the only device on the market at this time that is able to attain the temperatures in order to create the birth of collagen, of elastin, in order to provide support around the urethra to stop incontinence. And this is revolutionary because in the past, we've not been able to do that. We've been able to use meshes, we've been able to use slings. Today, we don't need to be that invasive or have the complications associated with those procedures. Geneveve is simply a 30-minute single treatment that can change my patient's life, change their sexual function, and actually treat a relationship. I feel that for women's health care to be where it's at today, Geneveve is at the forefront.